Okay, so I think we'll get started. The first item on the agenda is just welcome and introductions. So we can go around the room and do everyone on GoToMeeting last. So we'll start with me. I'm Andrew Deering. I'm a program coordinator at the Homeless Alliance of Western New York. I organize efforts in the Genesee, Orleans, and Wyoming area, as well as help facilitate implementing SOAR throughout the entire 5-county area that the Homeless Alliance covers.
I'm Sharon Egan. I'm Assistant Medical Relations Officer for Office of Temporary and Disability Assistance right here in Buffalo. I'm also Assistant General in
Seidel, I'm Medical Relations Officer at EDD.
I'm Karen Fitzgerald. I'm the Director of Services at Door Place.
Julian Andrew, I'm the Peer Benefits Advisor at Western New York.
Rosa Fernandez. I'm with Big Charities. I am the Program Assistant at Central Intake, and I do SNAP outreach.
West New York, 1-1.
Ashley Lennon, the Afternoon Case Manager for Madam Home House.
Lisa Gensler, that urban housing first case manager.
Lee Thompson, Social Security. SOAR Meeting.
Okay, so people on GoToMeeting, if you want to introduce yourselves, we can start with Abby if you're on the line. I don't know if she has audio. Jennifer and Deborah from Independent Living in the Genesee region. They're with us right now. Abby Muraco from OTDA. She's with us. Colleen Larson, the care coordinator, also from Independent Living. Let's see, and then there's homeless services from OTDA is that's Abby, where Abby Muraco works. And then we have someone else, Ravone Burnell, who's showing up. Not exactly sure where he's from. All right, can you all hear me on GoToMeeting?
I can hear you.
Great. Yeah, okay, I'm getting a lot of good responses. Okay, great. All right, the next item on the agenda is going over the SOAR action plan review. So if this is the first time for some of you to come with us or come to this meeting, this is kind of a Q&A with Social Security as well as Office of Disability, but it's also kind of talk about how the SOAR process is going, what works, what doesn't work, what resources you need from me to kind of help these applications be more effective in the community. So we did establish an action plan, so I just want to make sure that we're doing everything that we're supposed to be doing. So the first goal was completing applications and training, the action steps, identify service providers in Erie County, and pretty much with the Homeless Alliance being the coordinator for the Continuum of Care grants, we have connections with a lot of these agencies. We're reaching out. One thing I did want to mention is that if your agency has a lot of case managers going through the process, contact me. We can do some kind of cohort training. So if you have a lot of people, a lot of staff members going through the training, I can do a site visit. We can do the training it'll be an all-day training, but we can do it all in one pass. And then, okay, let's see what's next on the action steps. Identify and train case managers, coordinate one-day fundamentals. We do have a fundamental training coming up next week. If you complete the online course, you do get a notification inviting you to the online training. If you haven't gotten that, please tell me. So yeah, there is one next week. As of right now, we have our progress right now. We have 21 people in the community who have passed the online course and have gone through the fundamentals training. And then we have about 50 people in the pipeline. These are people who might have started the application and might have just dropped off after time. But in the next couple months, I'm really going to be pushing people to complete the training, reaching out to people, offering this cohort model of me training more than one person at a time, things like that. So developing a referral program with SOAR. Since we don't have, that's still kind of in the process of being developed. As more people get trained, there'll be more people to refer to. Especially so if like neighborhood legal services or other agencies that want to help their clients get Social Security benefits, but they need more holistic care, like if they have mental disabilities or substance abuse, they can reach out to these agencies that simultaneously have someone who can help them get Social Security benefits. So that's being developed right now. So goal 2, collaborations. So promote dialogue between SSA and disability. That's happening right now. Establish SSA contacts. We have one of the benefits of finishing the fundamentals training is that you do get exclusive contact to some of our SSA liaisons as well as Office of Disability contact information. You also get a nifty SOAR fundamentals training packet that has a lot of useful resources to help guide you along the way. Let's see. So with SSA and DDS, medical providers, develop a medical provider contact list. I developed a SOAR online webpage with the Homeless Alliance. I'll be showing that to you guys in a moment. Reach out and educate key medical providers. I've been talking to some of the local hospitals. Tell me which hospitals you guys want to see more connected with, and I can facilitate that. Payees, that's ongoing. Contact with Medicaid, that's ongoing. So tracking outcomes and sustainability. So I know
You drive better than I do.
we're still getting we're still getting applications through. Well, I mean, SOAR's still very early in the stages in Western New York, so we're just starting to see some SOAR applications come through. But as more people get on board, as more people get trained, I'm sure that'll change. But once you hear something, say you submit a SOAR application and you hear back, we want to know if it was a success, if it was a failure, what can we change. And one way to do that is to submit it through OAT. You get training on how to submit decisions through to the online application tracking at the fundamentals training. So whether it's a pass or fail, whether they're awarded the Social Security benefits, we want to know about it. All right, goal 4, local leadership team, hold bi-monthly committee meetings. We're in one right now. That's great. Identify additional applicants to be trained. I think we have a very good core base of people in the SOAR pipeline right now, so I think we're on track to have people who need to be trained being trained. All right, so that's pretty much the goals that we've covered. It seems like we're on track, or some of these things are just kind of ongoing that are being developed right now. So if there's any comments on the action plan, anything else you want to see on here, any gaps or holes that somebody might have observed? Okay, great. Okay, so I think we can move on to the next item. So I want to share some resources with you guys you might not be familiar with, but if you go to wnyhomeless.org, that's the Homeless Alliance's website, we have this neat little page. If you go to the COC drop-down menu to the SOAR section, there's the SOAR page that pops up, and it just kind of describes what SOAR is, the video describing the process, how it's different from the conventional process, different ways you can check for your client eligibility, things like setting up an online profile with My Social Security, or contacting your local Social Security office and seeing if there's a pending application, things like that. And it's all outlined in this website. Establishing a protective filing date, the different methods of doing that, that's often the first step in submitting an application for Social Security benefits. And there's also an outline of what a SOAR packet involves. There's the paper forms and also the online forms. There's also a short summary of the medical summary report. And if you're not familiar with the medical summary report, it's really the bread and butter of SOAR applications. It really describes the hardships of the client and connects their life to disability. There's also a section on the medical records right here. So medical records are also extremely important to the Social Security application process, also linking the client to their disability and how they function. So one thing I wanted to show you guys is I have some contact information of the different medical record offices in the area. And I reached out to them telling them about the SOAR process, trying to get some contact information, fax numbers where you can actually fax requests. And let's see. And Andon, you had a good question the last time we met. You asked about what if I need to pay for medical records of the client, and I asked them about that. And I guess it's actually a law if a client cannot afford medical records that they have to be provided for them. And you can describe your client's situation during in your request letter that you send to the medical records office, kind of explaining that your client cannot actually pay for this. And so for the medical records, we have here a request letter detailing useful medical reports and also the applicant's situation. the appropriate authorization form. Each hospital has their own authorization form, whether it's ECMC or Catholic Health or Kaleida Health partner. So they're all different authorization forms, and included with this, we want you to submit SSA 827 to authorize that you're disclosing this information to SSA. Just kind of, it covers our back, making sure that everything's compliant. So there are a couple different contacts here for ECMC, Buffalo General, Millard Fillmore, Women and Children's, Buffalo Mercy Hospital, Sisters of Charity, Kenmore Mercy, and also Buffalo VA. So you might have seen some fax numbers for some of these and not for others. I'm still working on getting contact information or fax information that will link you directly to these offices, so you can just fax over the request letter, the authorization form, and the 827 to kind of make it easier. And then at the bottom are just some important contacts. Myself, the SOAR team liaison, and our state team lead, Jan Ward. Her contact is there as well. Okay. So that's the online resource for the Homeless Alliance. I also wanted to show you guys this VA Caseworkers Guide that was released recently in the winter of 2006. So the VA values the SOAR process so much that they're actually partnering with SOAR and release this guidebook. So even if you don't work with veterans on a regular basis, this is a pretty nice resource to check out. It has things like let's see, different stories, but also explains what is SOAR, why is SOAR, 5 reasons you should be doing this. And also it goes through the documents in a step-by-step process, which I thought was very useful. It's a very user-friendly manual. If you want to check it out, I really recommend that you look at it. And I think it's beneficial not just for people working with veterans. Let's see. Another for caseworkers who are going through the SOAR online course right now, I want to show you some a nice resource that might help. It might help you finish the course and also walk you through it as well. So on the SOAR website, there is a field to the left, the webinars field. So there's 2 things I wanted to show you guys. One is the SOAR webinar online course walkthrough. It was a really nice webinar. It walked you through each and every step that you might that you go through with the online course. If you're having trouble, I recommend that you use this PowerPoint. There's the PowerPoint, and there's also the webinar recording. And also, if you have any other questions, feel free to contact myself. And another resource I wanted to show you on the SOAR website was this SOAR webinar with housing access and stability. This was a pretty good webinar. Just kind of talked about the benefit of SOAR and how it complements Housing First, different housing models with veterans doing HUD-VASH vouchers. It's a very good complement with all of these programs, and how having housing and Social Security benefits really improves the lives of your clients. So this is also a very good webinar I recommend checking out. Zipping through this. Okay, so now is really what I think is the most beneficial part of these meetings is really just to talk about the SOAR process, something that might be keeping you from finishing the online course, or something that might, some barriers you're seeing completing these SOAR applications. And I know, Leslie, you said you've seen some SOAR applications coming through your office now, which I think is great. So do you have any reactions to what you're seeing?
You know, Karen and both have submitted a few different plans with little minor problems, but everything's just want to remind to fill out the online disability report form. It's a little release timing thing. You want to protect the individual's file, so to get those releases signed, you get them in, and get you, review the case so that you know how to proceed, best proceed. So if the individual already has a pending case, you don't want to go in and fill out another disability report for somebody who's already has a case pending. You just go out and get the additional medical evidence that you need to, help build up the case you already have pending. Send them to the office with a note, to the individual's name, social security number, and we'll forward that on. Right, we forward that to them.
Okay, great. Any questions about submitting SOAR applications?
Once we get to online, probably quite a bit, so.
Yeah. And that's another really great thing about the SOAR process. Once you get trained, you know what to look for. Once you get trained, you do have contacts. Oh, they came here. Okay. So yeah, I think our audio or our microphone can only pick up so far. But for people on GoToMeeting, we had some case managers talk about when to submit medical information after submitting the application as a whole. And Leslie, our SSA representative, told us to just submit it to the office with a note with your client's name on it, and that should be fine. Yeah, with a social security number, yeah. And then I know we talked in the hall about if once the application goes to disability, that they should actually contact you.
I would recommend it.
Yeah.
I know that the SSA has the ability to plan cases of SOAR. But I do say that English in our office have literally 100 cases, so as a backup, my suggestion would be contact us directly and let us know that there's a SOAR case so that we can follow up with the MS and make sure they're aware of it before it starts to be. But that being said, my office is in a bit of a transition where I can't give you a contact number, but anyone knows how to contact our number. So if you have a pending case of disability, my suggestion is okay with you.
That's what I'm here for. So, but my only question would be, when would case managers know to contact the Office of Disability? Because we don't exactly know when the exchanging of the application happens.
It's a fairly quick process. If that's a state subsidy application that comes to us, it's an electronic process.
Yeah, you don't hold on to them.
Yeah.
You get them out of there the next day.
And it may take a day or two to actually decide to manage the process. It may take a little money, but I would say within a week of having received and accepted the application.
Yeah, in our office, when they do the electronic disability report, they have to pull that in within a certain amount of days. So it's not weeks. It's, you know, I mean, there's occasionally, every case has an amount. But generally it's in there and out of there. If everything's together. A lot of times you're missing something. So then that's going to add to your costs at the time.
Right.
What we're trying to do is once you give us the 1696, we're responding back to you with a receipt. The document, so you know that you have at that point. There should usually be a name or a phone number on it for the claims rep who has the case. If that's not the case, give me a call. If you have an analyst, they can send stuff right to the analyst.
Yeah, I was going to say that that's the brought up for 1696 and everybody's in these meetings before we're doing it. It's a very, very important one for our purposes because we get one, we're obligated to talk to people. Without that one, we're not able to. So if you call it something, you might not get any information at all. You have to complete the plan with representation. So it's very, very important.
Right. Yeah, and for those of you who don't, I mean, you pretty much just said it, but the 1696 is the appointment of representative form. It basically tells SSA and disability that whatever decision is made, it's okay to contact you. If more information is needed, it's okay to contact you. So
It's not only okay, but required.
Yeah.
If we need additional information, we couldn't go to the claimant, we could go to you.
Right.
And that helps us because we look for homeless people sometimes are older. At least we have time for
Did you say 1696 or 1696?
Yeah.
1696.
1696. Yeah, and if you want to take a look at that document, I have a completed SOAR packet right here. You can look at it after. And also, all forms are on Social Security's website as well as this this resource on the Homeless Alliance's website. Let's see, we have a question here from GoToMeeting. If someone is in a nursing home and Medicaid pays for their stay, can I still submit a SOAR application even though the caseworker at the nursing home said the individual would be denied because all their needs are being taken care of at the nursing home?
SSI pays only Medicaid.
Mhm.
The person is technically ineligible, depending on your stay there.
Mhm.
You may not be able to pay until you pay that claim. You get denied and you're not medical.
Okay. So do you think it would still be a good idea to kind of send in
To do if the person's expected to get out within 30 days, you do a free release kind of thing, but the person has to be getting out within 30 days of the application for us to be able to process it, not to deny it.
okay.
Based on the technical issue.
So just to repeat for people in GoToMeeting, so
If the person's in a public institution,
yeah,
they would not pay it. So if you have a prisoner who is not getting out within 30 days, you have a person who's in a nursing home that's being paid fully by Medicaid at a public facility,
mhm,
then that would potentially be a technical line.
right,
So it would have to be, they're expected to get out.
okay.
Application process.
Okay, so if in a public institution, they'd have to be getting out within 30 days in order to apply. Okay. All right. Any more questions? Any other responses from GoToMeeting? I want to emphasize this is a really good opportunity to kind of pick the brains of these agencies, asking them what they want to see in these applications, what will strengthen them. So I would encourage you to really utilize this time. Okay? All right. Well, it's way above schedule. So the next meeting is going to be in 2 months. I think it's like the third Tuesday of June, which is the 21st. So, and I'm recording these sessions as well. I put them on a YouTube channel, so you can listen in on these sessions once we're done with them. Also, once again, I want to emphasize if there are a couple people in your agencies going through the online course, let me know. We can organize some kind of cohort training. And I know this goes for the independent living of Genesee region as well, because I know you guys have a couple of people going through the online course as well. So if you want me to come over there and do some trainings, I'm willing to do so. And we have a fundamentals training coming up next week. So if you're close to completing the online course, I would encourage you to finish by next week. Or if you're close enough, let me know, and we can get you in on the training. So yeah, that's great. So, any other questions or anything? Great. All right. Well, thanks everyone for attending. Yeah, and thanks everyone on GoToMeeting for attending. I hope everyone goes out to vote.